fellow Congressional Committee, thank you very much for having me today. My name is Louis Calderon, and I am a registered nurse. I'm here to talk to you today about a quality issue that I feel is very important. The issue that I'm going to be talking about today is hospital readmissions. Hospital readmissions is definitely very important. Hospital readmissions rate high is no good. Hospital readmission measures have been touted not only as a quality measure, but also as a means to bend the healthcare curve. What this means is that hospital readmissions are associated with unfavorable patient outcomes and high financial costs. This is something we must fix. The Medicare Payment Advisory Committee has estimated that 12% of readmissions are preventively avoidable. Hospital readmissions can negatively impact costs and patients' care. Many studies have been published about hospital readmissions. Good study by Felix et al. In the Social Work Healthcare Journal went into why patients keep coming back. Other studies also showed how this is a major problem. Hospital readmissions are associated with unfavorable patient outcomes and high financial costs as per this journal and as per their finding. It is very important that we as healthcare professionals and you as the Congressional Committee address this issue. The indicators that show, this was one of the healthcare indicators, one of the quality indicators that shows significant deterioration or no improvement. Hospital readmissions is an indicator that shows significant deterioration or no improvement. ChartPac 2011 showed one example of this with their published readmission rates among nursing home residents. In the year 2000, it was 18%. In the year 2008, it was 21%. This was a big increase that needs to be addressed. When we looked at the journal article that was presented to me in my class of why not the best, results from the National Scorecard in 2011, they listed this as well as an indicator that shows deterrent or no improvement. In ChartPac, as we look at this that I'm showing you, hospital readmissions, if we look on this chart, the one on the left shows percentage of long-term nursing home residents hospitalized over a 6-month period. And then we look on the right, the percentage of first-time nursing home residents rehospitalized within 30 days, it went up. There's also other things I'm going to go about in this to show you what has been done to improve this issue. Not much. They did something called, they tried to do the HRRP, the Hospital Readmissions Reduction Program. This was a Medicare value-based purchasing program that encouraged hospitals to improve communications and care coordinations to better engage patients. The Affordable Care Act authorizes Medicare to reduce payments to hospital with excess readmission rates. So what they're saying is that if you don't reduce your rate, you're going to pay for it. This HRRP program was designed to improve healthcare by Americans by linking payment to the quality of hospital care. We all know about HCAP scores and how that affects care, but this is showing how hospital readmission rate affected care. Another thing that I would like to talk to you about besides what has been done, which was this, is what has not been done. Many things have not been done that we're going to go into, but now I want to talk about how is quality measured for this issue. Quality is measured for the Center of Medicaid Services, CMS. They have what's called a 30-day all-causes hospital readmission measure, and also using CMS's Hospital Compare. So what I'm showing you right now, the slide that you're looking at shows the all-causes hospital readmission. This 30-day all-cause rate is a risk standardized readmission rate. This measure includes admissions for Medicare beneficiaries who are 65 years and older and are discharged from all non-federal acute care facilities with a repeated claim within 12 months. And then you can also go on CMS's website and go on Hospital Compare. This is a consumer-oriented website that provides information on how hospitals are doing compared to other hospitals. And it also shows how well hospitals, how their quality is for their patients that come in. So it's measured, this is reported by CMS. Now I'm going to show you healthcare policies to improve this. What can health policy be used to improve this healthcare problem? One, we need to help hospitals focus on other reasons why patients return to the hospital. Housing instability, food insecurity, transportation challenges, other social determinants of health, mental health issues. These are other things that hospitals need to be focused on. These are that besides for reimbursement rates. One such policy that I would design, hospitals should help to develop social determinants of health screenings to identify patients at risk for hospital readmissions. There needs to be a screening tool designed and must be used that identifies patients for hospital readmissions. What am I requesting from this committee? I'm requesting increased funding to decrease hospital admissions. I would like a separate subcommittee to be formed to fight this issue. What I want this subcommittee to do, I want them to extend the availability of retail pharmacy hours in rural healthcare markets. I would also like to add or expand occupational therapy services. I want these services to be available to newly discharged hospital patients. And I want to expand post-discharge interventions that targets socio-economical challenges. So thank you very much, committee, for having me here. With the support of this congressional committee, we can fix this healthcare problem. And thank you very much for having me here today.